Hello, Susie, and hello, everyone who is there attending Susie's class today. I'm telling you, you are going to get so much information in this one class. My name is Paul Markey. I'm a physical therapist. I've been a PT for almost 29 years, and I work primarily with sports and orthopedic patients, but do a lot of other neurological patients, and I really have my hand in a lot of things right now. I'm also the podcast, also the Ortho Eval Pal podcast show, and I do a lot of videos on how to evaluate people better. And, I just want to start off by telling you how I became involved with using the Be Strong system and using blood flow restriction with my patients. I was treating this young lady who had a retropatellar chondral lesion, and she underwent a chondral transplant by Dr. Christian Latterman down in Boston. We were into about 4 months of rehab, and she was really just plateauing, not doing very well, still having a lot of discomfort, and we were very limited early on because we couldn't do a lot of weight-bearing activities, so that really kind of limited what we could do. So therefore she became weaker and weaker and weaker, and really our objective is to build quadricep strength as much as possible and strengthen the rest of the leg, the hips, and hamstrings, gastrocsoleus complex. But she was non-weight bearing on that leg for quite a long time, and just sustained a significant amount of atrophy in that leg. So when we started to try to strength train her, we had a real significant difficulty doing that. So I connected with Dr. Latterman and said, listen, we're really, not doing very well here. She's not progressing that well. And he said, well, have you ever tried blood flow restriction therapy? And I said, no, I really haven't. I said, I'd heard about it. And that's when he connected me with Susie. Susie and I did some Zoom video calls, and we got set up with a set of bands. Now, we started doing blood flow restriction therapy with this young lady, and within 1 week, we saw a significant change in her pain level and a significant difference in her ability to contract her quad better. So what we did was we just went with low weight, high repetition exercise, and we were really able to accelerate her really quickly. She bought into it so well that she bought herself a set and is using it 2 times a week on the off days when she's not, doing heavy training at this point. So she did really, really well, and that's what really sold it to me. And then I went, I was still kind of skeptical because of the whole restriction in the name blood flow restriction. And so what I did was I trucked it down about 8 hours to AIC and underwent a certification class with Susie, and it was at that point it changed my confidence level considerably in regards to setting people up with this, doing it with different patients, and I just really got rid of the fear. I understood the physiology a lot better behind it, so that made it a lot clearer for me also, and so it was significantly different. And so since then, and it's been maybe about a year now, I've been using blood flow restriction a lot with patients, from everything from an olecranon avulsion to a distal biceps rupture, total knee arthroplasty, distal tibial fracture. We were using it on a patient who had a tib-fib fracture and talar dome fracture. Same person, so not a lot of weight bearing here going on. So we were able to really press along with blood flow restriction early on to build that strength and to get them more active without all of the issues that come with non-weight bearing and overstressing tissues that really shouldn't be stressed all that hard. So what I'm going to do today is just give a little demonstration of how I utilize it with certain diagnoses. Now, the sky's the limit with this. So once you go through the contraindications with Susie, you understand which patients may not be good candidates. But really right now, I'm having a hard time finding people who are not good candidates for blood flow restriction. I've been doing it with people of all ages and with really good success. So the first thing I want to start with is just a simple knee program. So I had a gentleman who was a state trooper, about 60 years old, very strong, very aggressive exerciser, and wanted to push really, really, really hard. But I knew that if he would just damage that total knee arthroplasty. It was just too early. So, about 2 weeks into this after surgery, we started him on some blood flow restriction. And with very, very lightweight and high repetitions, we were able to burn him out big time. just using the BFRT. So what I'm going to do is just do a little demo on some exercises that I've used for total knee arthroplasty, this young lady with the chondral lesion, a lady that I have with a lateral patella compression syndrome, and a lady that I had with a proximal tibial fracture, a very comminuted fracture. So one of the things that I like to do is the shuttle. It's just a leg press machine, and on it right now I have very, very lightweight, and I have the blood flow restriction on. It's been on for probably 10 minutes now. It's comfortable, and I love these bands because you can go a half hour, 35, 40 minutes and still be comfortable with the bands on. So I have them, I have the pressure up, and I have really lightweight here. So if you have somebody who maybe has a tibial fracture or maybe a quadricep rupture, and you're just starting into the exercise and you don't want to push too hard because you don't want to damage those tissues, then you do something like this, which is just really super lightweight, high repetitions. You do your 30, and Susie will talk to you about the reps and the sets and how much rest to take in between. But I kid you not, it does not take a lot of weight to really burn your leg out. I'm going to jump on the table next to me. Everything's kind of congested, so I can get it all in the view of the camera here. So let's say somebody had an ankle fracture or an ankle injury, maybe an Achilles rupture. You could start them on bridging exercises, and you're doing the 30 repetitions, really getting a good burn. I love to do straight leg raises, and this is a killer. It really is. I start with no weight, and if you try this on yourself, you're going to find it's going to be difficult to get your 30 repetitions out of this. So I might start with no weight with the patient, get them to maybe a pound or 2 pounds, and you'll find that can be quite difficult to do and very exhausting, you'll find. Another exercise I like is a calf raise. So I might have them holding onto a wall and I have them going up and down on their toes. If doing full body weight is a little too much, then you can put them on a little leg press machine like this and just do the press from here with super light weight. You can do soleus presses with a slant board while they're seated. You can do a number of things to get that lower extremity working hard. So you do their set of leg presses, and then you take a 2-minute rest, then jump on, do some straight leg raises, and you can just kind of go from there. So just lots and lots of activities to do. The other thing that I like to do with these folks is if they can tolerate being on a stationary bike, then I will put them on a bike. So as simple as, this right here. The beauty of these bands is that the bands don't bother you when you're biking. They're not so large that they hit the seat or cause any compression or any pinching or anything like that. So you really don't need to have a lot of resistance to get that little burn in the legs when you're biking. So I may start them with a bike and then get into the rest of our leg exercises. Let's talk a little bit about upper body activities now. I see a lot of these, people who have tennis elbow, golfer's elbow. We've seen some bicep ruptures and different upper extremity issues. This is very appropriate for those folks. So what I'll do is I'll just give you a little rundown on some of the activities that I do with some of my folks, and this is just a small fraction of what I do with them. So I might start them off with about 6 minutes of upper body biking, 8 minutes of upper body biking, light resistance, just to kind of get that pump going, give them a little bit of a rest. I've had patients with bicep ruptures, and I'll take super light weight to get started with them, and especially when they can just start working at it, and I'll give them 30 reps of a bicep curl. They'll take a rest, and then they'll put that down 30 seconds, and they'll get back to it. An exercise I like to do a lot is wrist extension. I've been doing this really lightweight with my tennis elbow patients, really getting lots of repetitions in there and getting a good contraction, a good burn. We can do flexion also. Love to do supination, pronation. Nice and controlled. We're doing these, 30 repetitions. It doesn't take a lot of weight. That's the key right here, okay? It's nice and easy. Not a lot of weight. You can even do, I love the total back. This is a total back, and we use it for middle trapezius, rhomboid strengthening. It activates the rotator cuff. Very, very good exercise for your rotator cuff patients, and especially if you have tennis elbow. We know that there's a huge correlation to scapular weakness, so this is a great little exercise to do. You can do it with a pound. You can also work on scapular stabilization exercises like this. This is really fatiguing. I'm actually feeling my legs also because I still have the leg bands on and they're pumped up right now. So you can do combination activities. You can do, you know, if your patient is a little more advanced, you can do things like squat, curl, squat, curl. Super fatiguing. This is not a lot of weight. I'm feeling this already. And I know you think I'm a noodle. Wait till you try this in a little bit with Susie. You're really gonna have some fun. So that is BFRT with a little physical therapy perspective. I'm using it all the time. I'm probably using it once or twice a week with different patients, but it's just been a great tool, probably one of my favorite tools. There are lots of things like ultrasound and stuff like that, but the problem with that is that you're not getting reimbursement for ultrasound, or not much at all, if anything. Iontophoresis, electrical stimulation, there's really no more reimbursement for hot packs and cold packs. This is part of your exercise program, okay? So this is part of your therapeutic activity or your exercises that you're doing with the patient, so that just flows right into that exercise portion. So it's not a separate billing code or anything like that, so it's really easy that way. And then we get patients who see a lot of results, okay, and lots of response really quickly. I had a patient with a total knee. He'd been having this chronic swelling, and the first day we did blood flow restriction, he was totally fatigued, totally burnt out. Next day he came in and he's like, I don't understand this, but my swelling is less, and you constricted my leg. And it's true. He had less swelling and better quadricep contraction. So we're really seeing some great benefits from this. I have a gentleman also who is 70 plus years old and exercise on a regular basis, but he says, my body and my joints can't take the heavy weight anymore to keep myself toned. And so he purchased himself a series of, some blood flow restriction bands. I gave him a whole series of exercises for both upper, lower, and combination upper and lower. You can even walk on a treadmill with this and get a significant amount of benefit. So folks, I wish I was there with you right now and helping Susie out. And I wish I was a little bit closer because I'm really passionate about this. And you are not going to get anybody better than Susie to help you out. To get through the certification, to answer your questions. She has tons of experience. But if you have questions for me, Susie can help get you connected to me so that you can either call me, email me, text me. I'm all over social media with Ortho Eval Pal, so you can get me through some of those social media platforms. And I really hope you enjoy the rest of your certification course, and take care.